Hey y'all, it's Nurse Ryan back. So, one thing that I haven't mentioned before is I work Friday, Saturday, Sunday, 8 a.m. to 8 p.m. And then my brother Matt is back up on call from 8 p.m. to 8 a.m. Or he just takes straight call from 8 p.m. to 8 a.m. and then I back him up. Well, what ends up happening is we sometimes we get two things going at once. So we ended up having two deaths, and now I'm driving to one and he's going to the other. It's 7 o'clock in the morning, Monday morning, and so I'm heading out to since I'm on call and there's two things going at once, I get the second call. So I'm heading out right now. Today would usually be my normal day off, but I was actually planning on working 4 hours today anyway. So either way, headed out now, and that's kind of the job. What's nice is we get paid extra when we head out, when we're on call, but at the same time, you gotta get up in the middle of the night. But for whatever reason, people seem to pass early in the morning. So probably around 4 to 7 people pass, and I'm not quite sure why, but maybe because it's the calmest of the times. You ever been out at 4 in the morning, and between 4 and 7, it's a very calm time. And I've noticed with patients that are dying that if they're agitated or if they're in distress, they normally won't die. They're usually, the only time that they'll pass is when we finally get them comfortable, when we finally calm them down, and when they're finally able to relax, and then they become unresponsive, and then they pass. So let's talk about what happens when somebody's dying. So when somebody's dying, when they've stopped eating and drinking, we know that they have probably 1 to 2 weeks, probably 2 weeks. Some people even longer. So what we start doing is when they stop eating and drinking and then they become more unresponsive, we start what we call twilight visits. And twilight visits are where we just go and see the patient every day until death. And so that's one of my main jobs, working on call on the weekends, is I go and see those twilight visits, and I take call and do admissions. But so we go and see these people, and we go and make sure they have everything they need, make sure they have all the supplies, all the medications, make sure the family knows what's going on and how long it's going to be. And then we end up doing a bunch of education on the different signs and symptoms we see, and letting them know that we'll be there as soon as they pass. Well, so once they pass, they call us, and regardless of what time it is, we go out there, and we end up we check the patient. We have to listen to a patient for 2 minutes to see if they have any respirations or heartbeat. After 2 minutes, we call the time of death. So in South Carolina, you could call the time of death. A nurse can call the time of death. And then we end up, and then we call the mortuary. Well, mortuaries usually take about an hour, maybe sometimes 2 hours. So in that time, we get the body ready. We wipe the body down, wash the body, change all the clothes, change the brief, take out the catheters, take off jewelry if we need to, that sort of thing, and we get the body ready to go. Mortuary shows up, and in a very professional manner, they pick up the body. After they make the bed, they take the body out. They ask the family if they want to see him one last time, and then if not, they make an appointment with the family for the next morning or the next day, and they take the body out to the mortuary and do what the mortuary does. Now, the company I work for offers bereavement counseling for up to 13 months. So if anyone is struggling with the death of their loved one, we will help them with that counseling. And of course, I always try to follow up with them and call them. You get to know these families, and they kind of become your family. So this is Nurse Ryan, just going through a death and wanted to reach out and let you know what we do.